in entire Asia to perform 4 back-to-back MitraClip procedures in a single day, surpassing the earlier record of 3 procedures performed in Japan. Dr. Sai Satish, Senior Consultant Cardiologist of Apollo Hospitals Chennai, has performed this record-breaking procedure on 4 patients and giving them new lease of life. This minimally invasive method used in MitraClip therapy helps to repair leaking in mitral valve without open heart surgery and giving instant relief from suffering with best clinical outcome. As you all know, Apollo Hospital Network is the largest private healthcare provider in our country, starting from the inception of Apollo Hospital in Chennai since 1993. I am very delighted to welcome our founder chairman, Dr. Sai Satish, father of modern healthcare in India. Our chairman himself, a cardiologist, started Apollo Hospital in 1983 to bring healthcare of international standard within the reach of every individual in our country. After seeing the suffering of many patients without any advanced cardiac intervention, cardiac surgery program in our country at that time. His vision has led now India to become a global healthcare destination today.
Before I begin, I'd first like to say that it brings such a big smile on my face to see our chairman who inspires us all, our vice chairman who disciplines us all, and our MD who runs us all in one room. So thank you all for coming. I'd like to move on to the presentation. Can we have the first slide, please? I'm going to take 10 minutes of your time. Please. What is this MitraClip?
The heart is one of the most important. When freshly oxygenated blood from the lungs returns to the heart, it enters the heart through the left atrium. Left atrium relaxation causes the mitral valve to open, enabling blood to travel into the left ventricle. When the left ventricle contracts, the mitral valve closes to prevent backflow. In some people, the mitral valve doesn't close tightly, causing mitral valve regurgitation. When the heart beats during contraction, the blood from the left ventricle can flow back up to the left atrium. MitraClip is a unique, highly maneuverable transcatheter system for mitral valve repair.
Okay, regurgitation. If the heart or the top chamber, good blood flows to the heart's bottom chamber, and when the heart squeezes, this flows to the entire body. In some people, either because of heart attacks or because this valve gets damaged, when this valve doesn't close, the blood flows backward into the upper chamber instead of going forward to the body. Now, because of this, 2 things happen. Majority of the blood is going backward in the heart, which goes and fills the lungs, and the patients feel like they are choking. The second thing is because most of the blood is going backward, nothing goes forward. So the entire body doesn't get enough blood. And they have a miserable quality of life. So this is what this condition does. Now, when did this MitraClip first come into being? 2003 was the first in man. Then, bit by bit, they started doing cases. And in 2013, 2014, there was a landmark trial called the QUAD trial. What did this QUAD trial do? It found out that in heart failure patients, when you clip the mitral valve, the mitral clip is nothing but a small 15mm by 6mm clip. And this clip is actually moved into the heart while the heart is beating, and on the end, the leaflets, it just clips the leaflets together, completely abolishing the leak. This gives tremendous symptomatic relief to the patient. So in the study ended the first of all, the procedure is safe. Second of all, in the group that were treated with MitraClip, the number of hospitalizations for heart failure dropped drastically. Third of all cause mortality. No matter what the cause of mortality, people treated with MitraClip live longer than people who are not treated. All that quality of life improved. So their day-to-day functioning became drastically better. And this kept improving over time up to 24 months. So this is what we take away. Reduce the rate of heart failure, hospitalizations, improved survival, quality of life, functioning capacity in 24 months. Another study in 2020 was presented which showed similar results, if not better than the first study. So now what have we proved? There are 100,000 clips implanted globally so far. The therapy is miraculous, it works, it moves people from hospitals to homes and gives them their life back. Now I'm going to take you to a journey of 2 or 3 patients that were treated here. The first was an 86, 87-year-old lady, no diabetes, hypertension, no case of mitral prolapse, very active, doing well until 2017 March. Then, while she was playing badminton with her grandchildren, she developed sudden shortness of breath. She was rushed to the hospital, gasping for breath, and ever since then, her 6 months were terrible. Every month she had to go to the hospital to remove fluid from her lungs. So this was what we did. As you can see, it's nothing but just a clip. If you look at the pointer, it's just a tiny little clip that opens, and while the heart is beating, without stopping it, we find the exact area where the valve is leaking and just clip it together. Or tuni clip money. Expensive tuni clip, but it's still a tiny clip. So after the first clip, we realized that there was still a little more leak, so we went right by the side of it and put 2 clips. Now you can see this 3D, how you see this big bunch of tissue. This is a tone valve jumping out, and it's completely gone and the clips are in place. You can see the 2 clips. The pressure inside the heart went from high to nothing within 3 to 4 minutes of clipping the patient. This was her on day 1. She went home walking for the first time on day 2. Now all of you covered so eloquently this patient because all your papers put up the fact, because you were all so shocked that exactly 5 days after the MitraClip, she was in a press meet playing badminton, not only with people her own age, but she played badminton with her grandchildren right here at the Taj. Patient 2. 80-year-old gentleman, renal failure, heart attack, severe LV dysfunction, cardiac arrest survivor, multiple hospitalizations. And I think his family is here on Zoom. They wanted to come here, but because of the present situation, they couldn't, but they're here with us on Zoom. He was a surgical turn down. And I was actually away in South America. He realized that Apollo was doing this procedure and flew his father in, got admitted without even meeting any of us. We clipped him, and that huge leak disappeared to nothing overnight. Can you see that big hole in the valve? It's almost as though the valve is not even meeting. That's exactly how the hole is. And this is post-clip. Huge pressures disappeared to nothing. And look at these messages. He's saying, sir, for the last 6 months, I used to wake up at 4 o'clock in the morning because I used to have tea with my father. He could not sleep. For 6 months, this man was sitting like this and going to sleep. And he says, first time he's sleeping and I miss having tea. I said, that's a good thing to miss. Then he says, he slept all night. He says, what all can a little kid do? His memory is better, he's breathing better, he's walking better, his kidneys improve. Sir, this is a miracle.
Obviously put on certain medications. And we've been using those medications for a while, and after about a year, his ability to walk was decreasing. His physical ability to just sit and concentrate or do his own things was getting limited. More so in the last 8 to 10 months, when he was not able to go use the restroom on his own, is when things started really going south. He started having pulmonary edema. So I think MitraClip was really a magic for us.
This is the beauty of the therapy. When I spoke to the family, I was sure that it was only the heart failure. I convinced the children, we did the procedure. A message from America saying, sir, my father's watching television. 3 months later, this is 6 months later, and I am telling the patient, because even I didn't expect this, I'm saying, what a miracle, my God. That look at the incidence of heart failure in the world. 26 million cases of heart failure are diagnosed in the world. It is estimated to be 37 million because of the undiagnosed cases. Did you know that the number one cause of hospitalizations globally is heart failure? And once you get admitted for heart failure, half of the patients will get readmitted within 6 months for repeat attack of heart failure. So they have a very poor quality of life, and these are our precious 70, 80 and 90-year-olds. Look at India, increasing life expectancy, diabetes, heart disease, obesity. It's like all roads lead to Rome, everything leads to heart failure. 4.6 million patients in India alone of heart failure. 30% of them will pass away in hospitals. Half of them will keep coming back over and over again. And the worst part is, to have heart failure, the only way I can make you experience it is like drowning in air. Because your own blood is going back to your lungs and filling it so you can't breathe. That is the quality of life they lead. And I was in front of all of you. In the time it gives back quality of life to our precious 70s and 80s. Who is to put a price on this last 2.5 years that each of this patient has got with their families? Even in America, a country like America, 4 million cases of mitral valve disease are diagnosed every year. America's got a population of what, 390 million? 4 million cases. So India with 1.4 billion, we should have at least 4 to 5 million cases of mitral regurgitation. Even in America, only 1.5% of these people are treated. Half of them are too high risk for surgery, omitted straight away. The other half that are even fit for surgery are just managed medically because people don't know. People think, that complacency. But நம்மெல்லாம் ஒன்று புரிஞ்சுக்கணும். நம்ம தாத்தாங்க, நம்ம பாட்டிங்க, நம்ம அப்பா, நம்ம அம்மாக்கு மிக முக்கியமானது 70 இயர்ஸ்க்கு அப்புறம் அவங்க எத்தனை நாள் வாழ்றாங்க இல்லை, பட் எவ்வளவு நல்லா வாழ்றாங்க, அவங்களே ஒரு வேலை பண்ணிக்கணும். You all have elders at home, right? Don't you see how fiercely independent they are? And that is what this therapy gives. That is what you should listening, and I'm happy to take questions whenever you want.